September is AFib Awareness Month, shining a spotlight on a common but potentially dangerous heart condition that really affects millions of Americans.
Yeah, so important to talk about it here. So joining us to tell us more this morning, Dr. Eric Crespo, Medical Director of the Electrophysiology Lab at the Hartford Healthcare Heart and Vascular Institute. Doctor, thank you so much for your time today.
Thanks for having me.
Good morning. It's such an important subject here. And for those who may not know, can you tell us what is AFib?
Atrial fibrillation is an irregular and often fast abnormal heart rhythm. It's in fact the most common abnormal heart rhythm in the world, and its prevalence is increasing. Currently, there's an estimated 10 to 11 million Americans who are affected with the condition.
Doctor, what are some of the possible signs and symptoms of AFib?
So it's pretty variable, actually. Classically, people are described as having palpitations or irregular heartbeats or a sensation of their heart racing, but a lot of people don't actually have these symptoms. Most commonly, they report fatigue, shortness of breath with exertion, or just generally decreased stamina. And some patients don't even have any symptoms at all, which can make diagnosis more challenging.
Wow, scary to think there could be no symptoms. So what are the reasons patients should be concerned about this?
So aside from the fact that some people feel badly and we want to treat them to make them feel better, the big concern is the risk of stroke. When someone is in atrial fibrillation, their risk of having a stroke increases about 5 times over what it was before they had the condition. This is because the top chambers of the heart are not contracting normally when someone is in AFib. Clots can then form in the heart, and fragments of those clots can break off and go to the brain or other organs. It's a little more complicated than that, but that's the basic idea. Fortunately, we have very effective treatments to reduce the risk of stroke, primarily in the form of blood-thinning drugs, which have been shown to be very, very effective.
Yeah, doctor, that moves to my next question. How is Hartford Healthcare providing advanced care for patients who come in with AFib?
So the care for AFib has really evolved in the last 2 decades. It used to be that we didn't have very much to offer patients besides some medications. But more commonly now, we're doing a minimally invasive catheter-based procedure called an ablation, where we go into the heart through the blood vessels in the legs and create targeted scars to eliminate the areas that trigger the abnormal rhythm. This procedure used to be done by freezing or burning the tissue, which was effective but took a long time and risked injuring structures around the heart. We now have a new technology that was approved about 1.5 years ago by the FDA called pulse field ablation that uses short electrical pulses that targets the heart tissue very specifically without injuring the tissue around the heart. It has made the procedure much more efficient and safer for patients, whereas these procedures used to take over 6 hours when I started doing them years ago. Now it's usually under 2 hours, and patients are going home within a couple hours after that and back to normal activities quite quickly. It's really a huge advance in the technology in our field. And at Hartford Healthcare, we're actually involved in research using the next generation of these kinds of catheters so patients have access to the sort of latest and greatest technology that's out there.
Wow, life-changing technology and techniques. Thank you so much for joining us to talk to us more about this. HartfordHealthcare.org/heart. Get more information. Dr. Eric Crespo, I want to thank you so much for your time today.